Hey, how's it going? This is Dr. Joe Colopy with Colopy Chiropractic. We are addressing this patient. She came in with no complaints, just a concern from her school nurse that she had some scoliosis, which we took x-rays and confirmed. So we're just working with her as she's growing with her spine, just making sure that we take care of everything as much as possible to minimize the effects of that she experiences from having a scoliosis. So we're going to go ahead and get her adjusted today. So first thing I see is just a little bit of rotation in the hips, which we work on right there to address that. Now we're going to check one other thing. Have you keep your legs straight and lift as high as you can with your right first and then your left. Good. Any difference there? One being harder than the other?
Doesn't feel like it.
Feel even? Good. So that took care of what we found out in the pelvis. Now we're going to check the low back. Now we know she has a little bit of a right curvature there, so we're going to set her up to address that. So I'll have you turn and face me on your side. I'm going to bend this leg. Now what we're going to do is going to put pressure down into the way that the spine is curving to go in the opposite direction. Okay, onto your back. And then when we adjust her mid-back, we're going to go again in the opposite direction of that curvature to try and decrease the curve. So you're bending to the right? Correct? Deep breath in, all the way out. Alright, and then help you out. Swing your legs up this way. And the last thing we do is we want to reinforce the normal curves of the spine, which she has lost that curve in her neck. So we're going to work to get that going in the right direction, along with paying attention to cell phone use and studying and things like that. We've given her some exercises to reverse some of that posture that kids have a lot with being in school and being on their phones. Good. All set?
No.
And that's it.